أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله تعالى وبركاته. My name is Sharifah Hana Binti Abdul Rahman, the presenter of today's conference. And this research is conducted together with my teammates, that is Prof. Madya Dr. Nur Adha Abdul Hamid, Muhammad Farouk bin Matnur, Nur Zulfah Muhammad Abdul Salam, and Mashitah Binti Nabis Khan. We are a team of researchers from the Faculty of Sharia and Law, College University Islam Antarabangsa Selangor, Kuis, Bangi. And the topic of our presentation today is safety in elderly nursing home design and overlooked patient safety issues. All right, as an introduction, as we all know, in the next 3 years, 1 in 10 Malaysians will be aged 60 and above. And by 2040, the ratio is projected to be 1 in 5 Malaysians, and the country would have already reached aging nation status. Nevertheless, Malaysians are living longer too, with the average life expectancy for Malaysian women being 77 years and 72 for men. According to the National Physical Plan, according to the third National Physical Plan Policy, or also known as NPP3, NPP3 targets by the year 2040 that the aging population will be increased to 19.80%. And accordingly, to the preparation housing in the future shall take into account the requirements, the population aging like the elderly by giving priority to elements of comfort, convenience, support, livability, security, and emergency. The facilities provided are necessary, complete, integrated, user-friendly, and in accordance with the lifestyle of this group. Furthermore, according to the policy statement, National Policy for Older Persons, or also known as NPOPS 2011, according to the NPOPS, this is the evidence of Malaysian government's commitment to create older persons who are independent, with dignity, high sense of self-worth, and respected by optimizing their self-potential through a healthy, positive, active, productive, and supportive aging to lead a well-being life. All right. When we talk about safety and safety culture, the definition of the safety culture is the safety culture of an organization is the product of individual and group values, attitudes, perceptions, competencies, and patterns of behavior that determine the commitment to and the style of proficiency of an organization's health and safety management. Organizations with a positive safety culture are characterized by communications founded on mutual trust, by shared perceptions of the importance of safety, and by confidence in the efficacy of preventive measures. Right? The source of this statement is from the third report of the ACSNI, Advisory Committee on the Safety of Nuclear Installations, Sudbury, UK, HSE Books 1993. Right. The research method used in this research is, to better understand potential opportunities and challenges associated with interior design, and that may promote well-being, aging in place, and independent living in older adults. We, as the authors, have reviewed several relevant literatures and included their own expert opinions from a multidisciplinary point of view, including interior design, wellness, and also engineering. Right. To further discuss this topic, this study reviews the background of the misguided architectural model of nursing homes and the wicked compromises which are made in the design process. The design process is depicted through 3 case studies which are analysed with the intent to demonstrate that unsuitable regulations and an arduous reimbursement system constrain the design process of nursing homes. Furthermore, the analysis of the cases shows the need for a change in the design process of long-term care facilities so that architectural models for these settings may be improved to meet both the needs and the wants of the elderly. All right. With regards to improving the architectural design to promote longevity in older adults, with the increasing global population of older adults, there is a need for environmental interventions that directly affect their physical, psychological, and emotional well being to help them maintain or regain their independence and autonomy, all of which to promote longevity. One of the outcomes of this changing global demographic is the implication for the design of living environments for older adults. With a new set of needs and living standards, interior designers and architects are finding new opportunities and meeting exciting challenges to create ingenious solutions for seniors to promote their well-being and longevity. While a number of design philosophies such as accessible design, universal design, and rehabilitative design exist to address the needs of older adults, design practitioners need to determine how effective each approach is for each user. They, along with the caregivers, should provide means to help the elderly to compensate for declines in their physical and mental health. Right. So we also found signs for new directions and interior design for older adults. Each person ages differently and has varying degrees and kinds of abilities or disabilities. Universal design and accessibility standards have made spaces and places for older adults safer and more functional, but design that caters to the unique everyday needs of people may enable them to function at their highest capacity. For example, in one of our study, we found that the most effective intervention to improve the well-being of people with dementia, for instance, and their caregivers was by customizing and adapting private homes to specific user needs in a balanced combination with pharmacologic, behavioral, and occupational approaches. This is according to Van Hoof J, 2010. As a result, after summarizing existing environmental interventions for the aging population and their effectiveness, this review reveals knowledge gaps in interior design for the well-being and longevity of older adults, followed by a discussion of opportunities for future research that may fill these gaps. Some of these opportunities include finding rehabilitative design strategies that identify and address unique situational needs of each user, advancing multidisciplinary fields such as environmental gerontology that recreate security and independence for older adults even outside of their homes by implementing technically advanced design strategies which are flexible and adaptive to individual needs and integrating the internet technology into living environments, including for instance, voice-activated command technologies to improve the senior central role in enabling an optimized healthcare ecosystem. As the findings, we have also found that although older adults experience difficulty with new technologies, they are eager to learn how to use them to enrich their lives and to be independent. Designers, therefore, should take this opportunity and should not be afraid to consider technologies that will help older adults retain mastery of their environments. More research, however, is needed to understand patterns that reveal elements of design that make a significant impact on well-being and longevity. These research data need to become an integral part of design education and practice. And this is according to IMRI R 2004. Therefore, we suggest this paper has research literatures of senior living to discover the differences from normal architectural designs that covers well-designed senior housing, including a nursing home, a complex nursing community, and a senior apartment. And after those studies, this study recommends some effective sustainable designs in senior housing, such as building shape coefficient, energy efficient system, space optimization for efficient operation, and also healing garden concept and many others. Right. So, as a conclusion, we conclude that nursing homes are the last refuge in our society's long-term care for the elderly, the frail, and those with chronic illness and disability. And it has been said that a society can be judged by how well it provides for its vulnerable populations. Right? With that, I conclude my presentation. And before that, special acknowledgement, special thanks to the Fundamental Research Grant Scheme (FRGS) by the Ministry of Education (MOE) for our research entitled Pembinaan Model Kediaman Selamat Warga Emas. With that, I end my presentation with Assalamualaikum warahmatullahi taala wabarakatuh.